Hello friends, welcome to my new video. So today in this video I will continue our previous part, that is conjunctival disorder. As I said that I will cover some other conjunctival disorders in this video. So let's continue. So we will start with ophthalmia neonatorum. So ophthalmia neonatorum, it is a type of conjunctivitis which occur during the first month of life of a baby as a result of carelessness at the time of birth. So here carelessness means unhygienic condition can lead to ophthalmia neonatorum. So let us know what are the causative organism. So the causative organism of ophthalmia neonatorum is gonococcal infection, or the most common causative organism of ophthalmia neonatorum is Chlamydia oculogenitalis. It is the most common causative organism of ophthalmia neonatorum nowadays. So, what are the symptoms of ophthalmia neonatorum? So, in case of gonococcal infection, which is in between 1 to 3 days after birth, which is due to unhygienic condition, here some purulent conjunctivitis can be seen. Here purulent conjunctivitis means discharge will be a very much, as we understand in our previous video that in purulent conjunctivitis is the severe form of mucopurulent conjunctivitis. So where the discharge is also very much. So in ophthalmia neonatorum, if it is due to gonococcal, that is Neisseria gonorrhoeae, which is the causative organism of purulent conjunctivitis, here in purulent conjunctivitis, purulent discharge can be seen. And in other cases, mucopurulent conjunctivitis can also be seen. So this is the symptoms of ophthalmia neonatorum. And in case of chlamydial infection, the conjunctival reaction will be there. So let's move to the treatment option. So first of all, penicillin eye drops are used. Secondly, 1% tetracycline eye drop is used to treat the ophthalmia neonatorum of a baby. Other treatment options are systemic erythromycin 50 mg per kg and ciprofloxacin eye drop may be given. So I again say, don't use these drugs without a proper prescription of an eye care practitioner. It can be an ophthalmologist or optometrist. So always take this drug under supervision of eye care practitioner. Now let's move to other conjunctival disorder, that is trachoma. Okay, so trachoma is a chronic inflammation of the conjunctiva and the cornea, which is characterized by the presence of follicles and where papillary hypertrophy of the conjunctiva can be seen. So here in trachoma, what we see that there is in the later stage there is some tendency of the blood vessel to grow towards cornea. So in the late stage, trachoma can lead to corneal opacity. So if the person is having symptoms of trachoma, then at first mild itching of the eyes can be seen with irritation of the eyes as well as eyelids. Then there will be pus draining from the eye. We can see follicles on the bulbar conjunctiva. So trachoma can lead to some changes in the eye structures. Like we can see follicles in the bulbar conjunctiva, scarring of the cornea, trichosis also we can see, or corneal opacity. So let's see what are the changes trachoma lead to ocular structure. In eyelid, trachoma can lead to ptosis, tylosis. Tylosis means rounding of the lid borders. Madarosis, that is loss of eyelashes. and chalazion. Now in case of conjunctiva, trachoma can also lead to symblepharon and pseudopterygium also. In case of cornea, as I said, trachoma can lead to scarring. So that scar can be macula, nebula, or it can be leucoma depending on the depth of that scar. And as there is follicles, tendency of those follicles to creep over cornea, so it can also lead to loss of sensation of the cornea. So in case of lacrimal sac, trachoma can also lead to chronic dacryocystitis. So you can see the changes of the ocular structures in the pictures also. There is the follicle formation. Now let's move to treatment option. So what are the treatments? First of all, tetracycline eye ointment 4 times daily, or doxycycline once daily for 4 weeks. Then tetracycline eye ointment, tetracycline, that was systemic drug, and the second one is the eye ointment, that is 1% for 4 to 6 weeks. And another drug is sulfacetamide, that is 20% or 30%. It is an eye drop 4 times for 6 weeks. So if we say the causative organism of trachoma, then it is Chlamydia trachomatis. That is the causative organism of trachoma. Now let's move to another conjunctival disease, that is angular conjunctivitis. So angular conjunctivitis, it is a type of conjunctivitis which is characterized by mild inflammation of the conjunctiva and which is limited to intermarginal strip, which is especially at the outer and inner canthus. That is angular conjunctivitis. So what is the causative organism of angular conjunctivitis? That is Moraxella, which is a gram-negative bacteria. Now, what are the symptoms of angular conjunctivitis? First of all, discomfort with mild mucopurulent discharge can be seen. Itching and excoriation of the skin can be observed, and frequent blinking can also be observed in case of angular conjunctivitis. What are the signs? Signs are congestion of the conjunctiva can be seen. Now what is the treatment? Treatment of angular conjunctivitis is done by zinc oxide eye drop 4 to 6 times daily, or patient can also be used zinc oxide eye ointment. And also there is other drug, that is oxytetracycline, can also be used in case of angular conjunctivitis. But all these drugs should be used under supervision of eye care professional. Now let's move to another conjunctival disorder, that is conjunctival tumors. So conjunctival tumors are known as dermoid. So dermoids are solid white mass that appear most frequent at the limbus area. So they consist of skin, which is a sebaceous gland, and there is presence of hair follicles in the dermoid. So as you can see that there is the presence of dermoid in the limbus area, and there is a hair follicles is also there. So this is conjunctival dermoid, also called as conjunctival tumor. So this is conjunctival dermoid. Now what is the management option for conjunctival dermoid? that is the only management option is surgical excision is the treatment option. That's all. That's all friends. Thanks for watching and please don't forget to like my video and subscribe to my channel. Thank you so much.